Does it hurt? Is it painful? Am I going to pass out? What's going to happen during my treatment? That's probably the number one concern of most people that come here for cosmetic injection, laser treatment, in this case, facial harmonization, because it involves needles. We will be injecting your face. That's what's going to do. So it's definitely not as invasive as plastic surgery. The downtown can be less, will be less actually. But yeah, there's risk, there's side effect, there's important things for you to know that's gonna happen, especially if it's the first time that you're receiving injection in general. So that's what I'm going to talk about, the process, what's gonna happen in that treatment room, what you're gonna feel like, how it's going to be. So first thing, you came for your consultation, you know what you're looking for. It's a step one, the first time. You may come for the full deal, or you're gonna break it down in smaller appointment here and there. Chances are that your first appointment is when we're gonna do dermal fillers, chances are. Dermal filler requires needle, and we will be, as the first step, going really closer to the bone, more structural. We're gonna go deeper. Believe it or not, that's where it's maybe less painful, usually, depending, I don't want to say anything, but my personal experience, when we rebuild bone structure, when we do like the jawline, it's less painful because it's deeper, you don't feel it as much. Again, personal experience, chin usually pinch a little bit more. When I get closer to my eyes, around the eyes, I just don't like it. I'm fully aware of what's going on, I just don't like it. So it feels more like, ew. That would be my best description of it. If you've done your lip for an injection before, I personally find it less painful because doing your lips is quite stingy. But usually dermal fillers in general, it's not what I consider super painful. It's uncomfortable, it's annoying, it's not fun by any means, but painful is not how I would describe it per se. So you're gonna come for your appointments. It's either one of our injector or their assist will grab you, making sure that all the consent are filled out, all that paperwork, ask you a couple of questions, before you get your appointment. So we don't just slap you there and do the treatment. Ask you if you have any questions, if you're still game for whatever game plan you have, all that jazz. The first step is to freeze you. We don't freeze everything when we do dermal fillers. In all honesty, some area we do require freezing, in some not too much. So again, it depends, but most of the time for dermal fillers, we will freeze you. We'll apply some numbing cream, we'll let it sit for about 20-25 minutes. Then you will meet the injector that will inject that day. Sometimes it's the injector that put the numbing cream, it's just not always. Again, the injector will come in, making sure that all the paperwork is okay. The same thing, we're gonna have the conversation. If you have any question, this is the perfect timing. And then they will start the procedure. They will probably draw on your face a little bit, mark it, show you how it's going to look like, or the game plan. As we inject the dermal filler, the advantage of dermal filler is you see the results right away. We really see where the product goes. So at any point, if you're nervous, curious, feel free to ask, can I see what it looked like? It may not look good at that moment, but it's something that you see as you go, comparable to, let's say, Botox or Dysport. Those take longer to show, but usually dermal fillers, we see where we're going. Depending on the area that you're doing, the injector may actually ask your feedback or not, depending. So there's different technique. So sometimes we just use a needle, we go straight to where we want to go. Sometimes we use cannula, so we go under the skin and then we do our work under the skin. Depending if it's in vascular area, if there's a lot of blood vessel, we don't want to bruise you, we're trying to bruise you the least amount possible. We will use a cannula if there's a lot of vessel there. But yeah, so it all depends on the technique. There's so many different ways. Then we do the treatment. Dermal fillers can take anywhere from 10 minutes to the full-on hour, depending on how many syringes that we're going to use. There's so many different types of fillers. They're not all the same. If you have dermal fillers in your jawline, it's definitely not the same thing that we would use in your lips, for example. In your jawline, we want something that's solid, more projection. When in your lip, we're looking for, depending on, again, where in your lip, we want something that's more moldable, that's something that will stay in place, even if you talk a lot. But at the same time, we want like more volume, more plump, more hydration. So again, they're all different type of different fillers that we're gonna use. So after your appointment, we will give you a little bit of ice. Again, depending on the area, but most of the time we give you some ice just to calm down. It's normal that you're going to be inflamed. You swell a little bit, that's completely normal. Chances are that you will have some bruising. I'm not saying 100% of the time. It's just that there's a lot of blood vessel in your face. A lot. So we do try our best, cannula and all that, the technique, it's great. But the chances that you'll have a little bruise, okay, that's completely normal. Please don't get dermal fillers a couple weeks before your wedding, for example, just in case that happened, okay? Then you can feel some tenderness. If you inject it under the muscle, it does leave like a soreness that can happen. Again, that's totally normal, okay? What would not be normal would be excess bruising that actually get worse. You go home and it's getting worse. That's not good. You need to reach out, okay? So, but there is a risk. We could do an occlusion. So that's really important to discuss with the injector, the actual risk of it, because there are some we're injecting in your face. So really important, the experience of the injector, doctor, the supervision, that we're well equipped if something goes wrong. We will ask you to sleep on your back, to not have any hot shower, sweating, sauna, no heavy exercise. Just be mindful for 24-48 hours post-treatment. That's really important. Try not to have anything that would make you bleed. Example, like caffeine can do that, wine, alcohol, will make your blood thinner, then you could bruise more. Just be careful of those things. Sometimes, do not take any Advil before and after your treatment. What I just said before and after, by the way. So those are really important post-treatment. We will also not to have any facial laser treatment 2 weeks post injection. Then in 2 weeks after your appointment, we can ask you to come in for a follow-up. So if you swell a little bit too much, let's say we decide to stop, we need to kind of adjust things out, or maybe we know that you need to have more product later, so you can come back as soon as 2 weeks post-treatment. But you can't come earlier than that, because earlier than that, like the swelling and all that is not there. And you may not realize it. Maybe you love your lips or you like the results, but they are actually because there's a little swelling there still. That swelling can take up to 2 weeks. That's why we will not retreat you before 2 weeks. We want to make sure everything's settled, it's good, and then we can keep on going. So I hope this helped you understand a little bit more what to expect during your appointment and what to do after your appointment. Talk to you soon. Bye.